Hello and welcome everyone. Today we are discussing about chikungunya infection. Chikungunya is transmitted by mosquito and the main causative agent is chikungunya virus. It is alpha virus, genus of family Togaviridae. It is closely related to other alpha virus such as Ross River virus, Burma forest virus, etc., which are known to cause arthritis. It has three genotypes: Asian, West African and East Central South African, all named after their geographical distributions. Aedes aegypti and Aedes albopictus mosquitoes are most common vector of this disease. The virus itself is a positive sense single-stranded RNA virus. It has an icosahedral capsid which is covered by a lipid layer. It has a diameter of approximately 65 nanometer and it is sensitive to temperatures greater than 58 degrees centigrade. Transmission. The virus is transmitted in two different cycles, urban and sylvatic. The urban cycle refers to transmission from human to mosquito to human, while sylvatic transmission is animal to mosquito to human. When an uninfected mosquito feeds on a person who has a chikungunya virus circulating in their blood, the mosquito can ingest the virus. The virus then replicates in the mosquito over several days, gets into its salivary glands and can be transmitted into new human host when mosquito bites them. The virus again begins to replicate in this newly infected person and reaches the high concentration in their blood. The cells prone to infection and virus production include human epithelial and endothelial cell, primary fibroblast and monocyte derived macrophages. Transportation into target organs such as muscle, joint, liver and brain has been found to be caused by infected monocyte derived macrophages. Symptoms. Incubation period usually ranges from 2 to 12 days after bite of an infected mosquito. The abrupt onset of fever and severe joint pain are the main presenting symptoms. The joint pain is often debilitating and can last for months or even years. The other common signs and symptoms include joint swelling, muscle pain, headache, nausea, fatigue and rash. Diagnosis. It can be measured directly in the blood samples collected during the first week of illness using the tests such as reverse transcriptase PCR. The antibody levels are typically detected by first week after illness onset and can be detected for about 2 months. Chikungunya IgM antibody can be detected by ELISA method or a rapid CAR method. Antibody test may show cross-reactivity to other viral infections such as dengue. So be cautious while interpreting the result. Treatment. Mainstay of treatment is symptomatic relief. It is done by adequate hydration, rest and pain and fever medications such as paracetamol. WHO discourages the use of aspirin and most non-steroidal anti-inflammatory drugs during the first 48 hours due to risk of aggravating the platelet dysfunction. There is no specific antiviral drug treatment for chikungunya viral infections. So this is in short about chikungunya and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.